So it looks like the trickle in is decreasing, so maybe I'll go ahead and get started so that we make good use of our time. My name is Melissa Armstrong. I'm one of the Movement Disorders specialists here at UF. I've just been here since the fall, so this is my first conference too. And what I'm going to be speaking about today, well, it's, this room is people who are early to Parkinson's. I really think this topic is relevant to people across the Parkinson's spectrum. And with this talk, we're going to be talking about how you managing your own health is really a very important part of living successfully with Parkinson's. And I'm not just talking about that in general, and it's not just touchy-feely, but there's actually research that shows that people who take control and manage their health do better with their Parkinson's, and I'm going to talk about that on some of the slides. So this is one part of taking care of yourself and treating the Parkinson's. So I just want to acknowledge first off that Parkinson's affects every aspect of your life. And you will have, depending on what stage in the Parkinson's you're at, you may have movement problems, you may have difficulties with memory and thinking. We know that Parkinson's can cause depression and anxiety as part of the Parkinson's. And we know that Parkinson's causes other symptoms like fatigue and constipation. So it can affect either now or in the future all aspects of your life. And that has implications for things like your relationships with your family, your friends, your work, long-term planning. And so it really is a disease that can affect in one way or another all elements of your life. I also want to take a minute to just say, if you're new to Parkinson's, give yourself a break as you adjust to the diagnosis and think about it. And I like to put this slide up because a lot of times we don't recognize or we don't discuss in the clinic that there's a process that you go through when you're first diagnosed with Parkinson's. There's a lot of discussion about stages of grief when someone in your life has died, but those stages of grief can be very relevant when you get a diagnosis or news like Parkinson's. And I have seen a lot of these stages of grief in my clinic as people adjust to the diagnosis of Parkinson's. So the first stage of grief, and you may not go through all of these, or you may not go through them in order, but it's very common that people are initially in denial. It's good to get a second opinion to make sure that this is really the disease that you have, that you're getting the right treatment. But sometimes I'll see people on their third or their fourth or their fifth physician because they just they don't want that diagnosis. They want it to be something else. The second stage is anger. And people can get angry at the diagnosis of Parkinson's. They might get angry at me, or you might get angry with your spouse, or you just might be angry in general. I don't see a lot of the bargaining in my clinic because I think that's something people do on their own, but it is one of the stages of grief. There can be depression as you adjust to the diagnosis of Parkinson's, and that's normal. That's one of the stages of dealing with a diagnosis, but I think it's very important to point out something that Dr. Fahn and our social worker already mentioned, is that depression and Parkinson's can be part of the Parkinson's. So just like the chemical changes in your brain may make you stiff or slow or shaky, the chemical changes in the brain can make you depressed or anxious too. We know that over half of people with Parkinson's will have depression or anxiety at some point in their disease. So what I want to make sure, as you adjust to the diagnosis of Parkinson's, if you're depressed as part of that adjustment process, that's normal. But if that goes on or you can't cope with it or can't deal with it, it may actually be due to the disease itself. Depression in Parkinson's is almost a 1-2 punch. You can get depressed from the frustrations of having the diagnosis or living with the disease, but the chemical changes in the brain in Parkinson's can do it too, and it can be important to treat that. And then finally, it's important for everyone with Parkinson's to work through these stages and eventually get to the point of acceptance, because we really can treat you better and you can live better with the disease once you've come to that stage. You don't have to be there right away. Take the time to process it, deal with it, handle it, but make sure that you are taking the steps you need to get through and accept the diagnosis so that you can move forward from there. So this is a little bit off topic, but I think it's important to recognize in a group that could potentially include people with a new diagnosis that these stages are normal. They're good. They're healthy. People with Parkinson's will go through them, and spouses will go through them, kids can go through them. This is normal, so don't cut yourself short. Take the time to work through the diagnosis, but make sure you do get to that acceptance stage over time. So now what? You've accepted it. What happens now? You can help yourself, and the research shows it. So I really want to emphasize today, I'm just not giving you like a self-help talk. I'm going to give you some practical strategies, but this is all based on research. Research showing that people who learn and believe that they can help themselves with Parkinson's do better. And I show some of that here. So people with Parkinson's who believe they can impact their own life and health have less disability. You think, well, that's kind of weird. You know, you mean my Parkinson's may not be as bad if I believe I can impact my health? That's what the research shows. Now, that same research also shows that people who are more optimistic do a little bit better. Well, that's a little hard to change. You know, some of us are optimistic, some of us are pessimistic, and I don't think I could get up here today and say, be more optimistic. I don't think that's very real. You know, you are who you are in that sense. But regardless of whether you're an optimist or pessimist, you can take control of your life and health with Parkinson's. And by doing that, you can have a better experience living with the Parkinson's disease. And that's irrespective of the character traits that you have. So there's this term called self-efficacy. It's a little bit of a fancy name, but self-efficacy is the belief that we can achieve influence over the conditions that affect our lives. That doesn't mean you think you can cure your Parkinson's. It doesn't mean that you're going to be able to fix everything with your Parkinson's just by using your mind. But it's the idea that you believe that you can influence your Parkinson's and influence your life with Parkinson's in a positive way. And you can. And we're going to go over today how you might do that. There are different strategies to take. Self-efficacy has been shown to be beneficial not just in Parkinson's, but also when looking at populations in general, when looking at people with multiple sclerosis, when looking at people with stroke. So while there's research that shows in Parkinson's that if you have this sense that you can influence your own disease in your own life, you do better, it's not just in Parkinson's alone, it's also in other diseases, including other neurologic diseases. And in general, this idea, people who have self-efficacy have better self-reported health, they have better life satisfaction, they're more physically active, they're less depressed, and they have lower levels of pain. And this is across the board, not just in Parkinson's. So when I talk about treating with Parkinson's disease, it's important when you think about how do I manage my Parkinson's, how do I treat my Parkinson's, there's evidence for 3 different ways you can make your Parkinson's better. The first one is medication. That's the obvious one. We have lots of evidence now that medicine will make your symptoms better. You heard all about that from Dr. Phan today. If you take medicine, symptoms get better. Number 2 is exercise. So over the last 5 years, there's been a lot of work in Parkinson's on exercise, and the research is very clear that people with Parkinson's who exercise do better. Now, different studies look at different kinds of exercise. People do weights, people walk, people go to the gym. My own impression is that there's not a lot of proof that one single kind of exercise is better. There's not one regimen that's better. I can't tell you how many times a week you should be going to the gym. But there is clear evidence from the last 5 years and more every year that people with Parkinson's who exercise do better. And when you come and see me in clinic, those are the 2 things I often focus on. What kind of medication might you want to use, and making sure that you exercise, because those are 2 things. But what I just told you today is that there's a 3rd thing, and this is a little bit harder to cover in clinic. Our appointments with you are not very long, and that's why it's a really important point for us to talk about today. And that 3rd thing that has proof for making Parkinson's symptoms better or living with life better is this idea of self-efficacy, taking control and helping yourself. So it's really a 3-pronged approach. So I know someone in the room is a little skeptical and say, okay, taking control, that sounds really good. Tell me how that might happen. Like, how is that helping my Parkinson's? Well, there are direct ways and there are indirect ways. So the 2 direct ways are that this idea of taking control affects the other 2 things that we know helps people with Parkinson's. We know that people who take control take their medications more reliably, and if you take your medication more reliably with Parkinson's, you tend to do better. We also know that people who take control tend to exercise more. And so that's another way that directly self-efficacy will help those other things that helps you with Parkinson's. People who take control exercise more, they take the medicine more regularly, they do better. But self-efficacy can also help you in your Parkinson's in other ways. We know that people who take control with their Parkinson's have a greater sense of control. They advocate better for themselves, and that can be important when you see your doctor or when you're in the hospital. They become more proactive about their health care. They understand their symptoms better. And by understanding your symptoms better, you can manage them better. As I mentioned, they're more likely to take their medicine and exercise. They have support teams, they're more accepting, and they have less anxiety and depression. So this idea of taking control can help you in multiple ways, both directly and indirectly, and thus improve the Parkinson's. So you hear this term, taking control, self-efficacy, that's all well and good, but how can you do it? So what we're going to do for the rest of the time is go through 4 steps about how you can take control more and increase this idea of self-efficacy in your life. And the first way the research suggests that you can do this is by knowing more about the Parkinson's disease. And we're going to go through a few different ways you can do this. So with understanding Parkinson's, the first thing is understanding the disease that you have. There are lots of different ways that you can do this. Some of this is going to happen in the clinic when you talk to your doctors. Your doctors are going to tell you about your disease, what to expect, about the medications and side effects. But you all know, as I mentioned earlier, your visits with us are not that long. And also, everyone with Parkinson's is different. So I can't possibly predict ahead of time which symptoms are going to be the biggest deal for you. So I hopefully will educate you every time you come to see me, and I'm sure that's true for the other physicians as well. But we just can't tell you everything that's possible about Parkinson's in that short time we see you in clinic. So it's important for you to learn more about the disease yourself. There are lots of different ways that you can do that. If you're someone who uses websites, we didn't hand them out, but on your way out there's a handout. It's a one-page handout with a lot of different resources for Parkinson's disease, some of our favorite websites and some other resources. And so our website for UF has information. There's information on the National Parkinson Foundation, the APDA, the Michael J. Fox Foundation. If you're someone who doesn't really like websites, Dr. Oken, who runs our center, has a couple books out about Parkinson's. I put one of them up here, Ask the Doctor About Parkinson's Disease. And many of these organizations, while I gave you the website link, they also have phone numbers that you can call if you want them to mail you the information. And then we have that information booth out there today where you can pick up more information. So there are lots of ways that you can become more informed about your Parkinson's and symptoms that you might experience. For those of you who like technology, there are also a lot of apps now that let you do this. So up here and in the handout, I tell you about a couple apps there are that teach you more about Parkinson's. So these are educational apps through these foundations. But up here I also show that there are now Parkinson's diary apps. If you want to track your symptoms and track your medications, that app could help you manage your disease. And then for those of you who are interested in research but want it to be easy, especially if you have to come a long distance to see us, there's actually a research app now where you join the study and again you kind of track your symptoms and your medications, and you can use that information personally, but you also allow the researchers to learn from you, to learn from your ups and downs. And in the future, when a lot of patients are participating in this research app, they can help us learn more about Parkinson's disease. The second thing that falls under this category of knowledge about Parkinson's is medication. And it is so important for you to keep track of your medications, the ones that you're taking now, the ones that don't work, the ones that fail. And there are different ways that you can do this. So this is a medication log for Parkinson's. I put the link for this log. It's available for you to print out online if you like this. If you don't have to use this one, you can do it on your own. You can create a log. You can do it on your computer. The Aware and Care Parkinson's Hospital Kit has a sample log that you can use. But it's really important for you to know the medications you're taking, how you're taking them, why you're taking them, and whether they're working or having any side effects. That helps you manage your Parkinson's, but it also helps us when you come know how that we can help you. It's especially important to keep track not only of what you're taking now, but what you've stopped taking. So we live in Florida. A lot of people come see me 5 or 7 years into the Parkinson's when they move to Florida after they retire. And often they can't remember what they've tried. Or I'll give them a list of names and they'll say, oh, I took that one. And I'll ask them why they stopped it and they don't know. Was it not working? Did they have a side effect? Was it a low dose such that we should try it again? So it will really help your doctors 5 years from now if you keep this list now, so that if you come to me in 5 years or 10 years saying, what else can I do? I know what you've tried before. I've known if you have a problem or had a low dose or a high dose. That will help me take care of you better. And then part of it also is knowing how to take care of your general health. So it's very important for you to know, especially if you're new to Parkinson's, that many people with Parkinson's die from things totally unrelated to the Parkinson's. Heart attack, stroke, cancer, all the normal stuff. And so it's really important to know about your general health and take care of your general health. Don't just focus on the Parkinson's. And know about and manage your stress and anxiety, because we know that that's a big contributor to quality of life in general, but we know that can also have an influence on Parkinson's symptoms. So the second area that you can take control and help your own life with Parkinson's is creating partnerships. So you should have partnerships both with your family and friends and with your medical care team. So here I talk about the importance of having strong relationships with your spouse and with your family, with family and friends. You should make sure that you have a strong relationship with your physician, and you should figure out who your care team is. Now, if you come to UF, let me tell you, you're really lucky, because until I came here last fall, never have I worked in a clinic where physical therapy and occupational therapy and speech therapy, and social work are all in the same spot. That's amazing. But your care team, you shouldn't think of it just confined to the people who you see when you come to see me in clinic. Your care team may be the trainer at the gym, if that's the route you decided to take. It may be the counselor you see close to home, or your psychiatrist. It will be people at the movement center and people outside the movement center. And they don't all have to have medical degrees. I have some people who have really good relationships with their personal trainers to help them with their exercise. And so think about who in your life is supporting you along this process, both in the day-to-day just living, and then also from a medical setting. And then other opportunities are joining a support group, whether it's here or something that you have locally, and then also knowing about local and national Parkinson's resources, which is part of that sheet that I'm sending around or that you can pick up on your way out. So opportunity 3 for taking control and managing your Parkinson's is proactively managing your disease. And the first thing, kind of subcategory with that, is taking responsibility for managing your own health. Keep track of your symptoms and your medications. That will help your doctor know how to take care of you next time you go back into clinic. Keep up-to-date medical records. It's important for us to know what's happened since your last visit. Prepare for your appointments. If you have one thing that's really bothering you, in the 3 to 6 months between times that you see us, tell me straight off when you come see me, because I want to make sure that we use our time wisely to address the problem that is most affecting your day-to-day life. Exercise. I can tell you to exercise, but ultimately it's up to you to do it, and it really is an important part of taking care of Parkinson's. And then if you do notice that you just have unhealthy habits, whether it's eating or not exercising or mentally, make sure that you identify those and take care of them. Part of preparation is being prepared in case you ever do need to go in the hospital. And if you don't have this Aware and Care Hospital Kit that Frances mentioned in the last talk, they're available for free at one of the desks out there, and I encourage you to take them so that you are ready for the unexpected if you do have to go in the hospital. make goals and work towards them, and keep in mind that those might be disease specific, but those are also life goals. You're a lot more than your Parkinson's. So any goals you have in your life, they shouldn't all be Parkinson's related. You're a lot more than that. So don't be defined by this diagnosis you just received. And then the last thing I want to talk about in this category is communication. And communication is so important. And it's not just about what happens when you're talking to me in clinic, but communication is also you knowing what your goals and your values are, discussing your concerns with your team, and advocating for yourself. And we're going to go into that a little bit more because it is so important. So our clinic feels very strongly about what's called patient-centered care. And patient-centered care actually has a formal definition from the Institute of Medicine, and that's care that is respectful and responsive to individual patient preferences, needs, and values, and where patient values guide clinical decisions. There are two words used in both of those. It's value. It's response to your values. But I can't do that if I don't know what your values are. And so it's really important that you've thought about what your values are and that you tell me or your doctor so that we can target our care to those values. I have a paper that recently came out for doctors about how to do shared decision making and do patient-centered care in neurology, but you're a big part of that. And so step one is sharing your values and goals with your physician. I need to know what your values and goals are so that I can make sure that we're targeting your care to address them. Step two is listening to the pros and cons of your different options. And if I know your values, I can target those pros and cons so you understand what the pros and cons of any given decision are for you and your values. And then step three is making the best decision for you. So let me give you some practical examples of how knowing your values will influence the care I might give you in clinic. So a couple times today it's come up about these motor fluctuations, the off and on time when the medicine isn't working very well, on time when the medicine is having a good effect, and how as your disease progresses, you're going to have these ups and downs due to how the medicine works and how the Parkinson's is happening in the brain. Well, our goal is to minimize those. But sometimes in Parkinson's, people have fluctuations and we just can't get rid of those ups and downs. And so then we kind of tend to swing one way a little bit more than another. Let's give you a little bit more on time and less off time. Or if the dyskinesias really bother you, which is more when the medicine is at peak dose, let's do a little bit less of that. To make that decision, I need to know which one's bothering you more. Are you more bothered by the wigglies? Or are you more bothered when your medicine is low and you're stiff and slow and shaky? Unless I know your life experience, I don't know how to help you make that best decision. Another example is what Dr. Fahn mentioned, that drug called Artane. Well, Artane or trihexyphenidyl, it can help tremor, sometimes when nothing else is, but it does have that side effect of cognitive slowing, where you feel mentally foggy or confused, and it's not just in older people that can happen, though it's more likely in people who are older. So I need to know from you how much the tremor is bothering you. Is it interfering with your life so much that it's worth risking this side effect of mental slowing to try it? Or do you need to be mentally crisp for your job such that even with the tremor, that's not a good idea? A couple more examples from my own clinic, so more goals than values. A patient came to me in one January and said, my daughter's getting married in June, what can we do? And so knowing her goals, we kind of reframed what we were doing with treatment. Normally she wasn't too bothered by her tremor, but she didn't want to distract from her son's wedding, so we talked about, well, what might be our options in the short term to focus a little bit more on the tremor. And then she also wanted to make sure she could walk her son down the aisle and dance, and so we made sure that we did physical therapy in the 6 weeks right before the wedding, so she was walking and dancing as good as possible. And then if you're upcoming retirement or disability, I need to know that too. So if you're going to see me next week and say, you know what, I think I'm going to retire in the fall, or I think I just can't work anymore, I need to know that for two reasons. One is, if it's a disability issue, Maybe we can change your medicines, find a way, if it's a typing issue, maybe I can increase your levodopa so that you don't have to stop working if you don't want to. Or I can get you connected to Frances to make sure that she told you disability is complicated. Let's not do that let's not it be an emergency. Let's start planning for it now if you think that's something you want to do later this year or next year. So if you communicate to me your values and your goals, I can take care of you a lot better. So what's your role in that? Well, know your own goals, know your own values, your priorities. You'll need to listen to the pros and cons and ask questions because ultimately, you are different than anyone else I have seen with Parkinson's. And so what I did with the person in the appointment before you may not match you at all, but you are a really important part of that. I don't know your life, your situation, your goals, and so you have to help me understand those. And then listen to the pros and cons to make the best decision for you. And one other caveat, or one other thing I want you just to remember is, there's not really a rush to make these decisions in Parkinson's. Parkinson's is usually slow. Whether you make the decision sitting in front of me in clinic, or you say, you know what, I need to talk about this with my spouse on the drive home, I'll call you next week, that's fine. That's not going to make a big difference in your care. So sitting in front of your doctor, you don't have to be like, oh my gosh, I have to make this decision, I have to make this decision. Take time to think about it. Taking a couple days or a week, not a big deal. And so if you're not sure, I would encourage you to say, I just don't know, let me think about it, let me talk about it. My husband could be with me today, let me talk to him at home and then give you a call back. And that way you can really take the time to make the best decision for you. So that's it about communication. And then the fourth thing is manage your attitude. So there is some of this, we talked about optimists and pessimists at the beginning. And so some of this is outside your control, but some of it's inside your control too. So making sure that you're thinking positively, that you're focusing on what you can do, that you're evaluating your options to make the best choices. And then one thing I think that is particularly important is to reframe your expectations and your approach. Are there new ways that you can do your hobbies, even if the Parkinson's makes it different or harder? So what I don't want you to do is give up something you love because you can't do it quite the same way with Parkinson's. There are a lot of ways that you can adjust your hobbies or adjust what you like to do so that you can still do them. Now, you do have to come to the point where you're willing to do them in a slightly different way. So maybe you're someone who's always walked the golf course, and maybe you need a cart now. Or maybe you're someone who loves gardening, but you find that you can't get down and get up very easily anymore. So maybe you need to think about things like container gardening, where you could do most of it on a table, sitting or standing. That can be a hard thing to accept because it's something that you've loved to do and you don't want to do it a new way. But I would really encourage you to kind of reframe how you think about it and figure out ways now to do the things you love a little bit differently. Also, when you focus on possibilities, I would encourage you to keep planning, keep doing the things that you love. This is Parkinson's 101, so some of you may still be very early in your disease. Don't put limitations on yourself just because you have this label now of Parkinson's. You can probably do a lot of what you want to do, irrespective of what label you're wearing now. So I had a patient come to me once and he said, my life goal was to do Machu Picchu and to hike those trails. And I said, do it. You're early in Parkinson's, you're walking well, why are you giving up that goal? You don't need a bucket list with Parkinson's. You've got a long time to live with Parkinson's. But if you have that one big goal, let's make it happen. I did tell him I wouldn't wait 10 years to walk Machu Picchu because we know that Parkinson's affects gait as Parkinson's goes along. And I didn't want him, using his walker and tripping along the roots on the miles to Machu Picchu. So maybe that was a goal to do sooner rather than later. But there are lots of things that you can do with Parkinson's. And you don't need to adjust everything, especially early in the disease. So I just want to end by adding one more kind of thought about this taking control. So we have talked a lot today about taking control and how the research shows that when you take control and believe that you can influence your Parkinson's disease, that you have a better experience of Parkinson's and less disability. That's what the research shows, less disability when you take control. And so we talked a lot about clinical care, but there are other ways that taking control can give you opportunities with regards to the Parkinson's. So research. So if you are interested in research to learn more about Parkinson's, to learn about new drugs, to try new drugs, we have lots of clinical trials at the center. They do different things, so some of them look at brain imaging in Parkinson's, some are new drugs for Parkinson's. But if you want to take control by saying, I want to learn more about Parkinson's for myself and for the next generation, you can participate in a clinical trial. Now, your opportunities for participating in research aren't just limited to enrolling in a clinical trial. So now there's a big push in healthcare to say that it's not just doctors who should be deciding what research needs to be done. It should be people living with the disease. And so there are organizations, both at UF and in general, where you can, as a partner, be a researcher on Parkinson's. So you would join a doctor or a researcher to say, hey, what research do we need to do? And how should we design that study and how we should do it? So if you're someone who really gets excited about research and wants to design research, there are now opportunities for you to partner with researchers from the very beginning. Go ahead.
I have a question about that.
Yeah.
I've been interested in being a research and participant, but I'm left-handed. Now I understand there's two hemispheres of the brain, but I thought, what the heck does that? What's the difference?
So that depends a lot on the study, and that caveat sometimes has to do with the brain imaging studies in particular. So we know that people who are right-hand dominant or left-hand dominant, their brains and the hemispheres work a little bit differently. And so sometimes, especially when they're taking pictures of the brain, they want to make sure that there's consistency from all the subjects. It shouldn't really matter for other Parkinson's research, like a drug trial. It shouldn't really matter if you're right-handed or left-handed. And Parkinson's, what side it affects seems to be totally random. It doesn't have to do with your handedness. We don't know why that happens.
Thank you.
You're welcome. So the second way that you can get involved is support. And that could be doing a support group. It could be mentoring someone else who has Parkinson's. It could be receiving mentorship for someone with Parkinson's. So one way you can take control is by supporting yourself and supporting others. And then a third way that you can take control, if this is up your alley, is advocacy. So there is an advocacy organization called the Parkinson's Advocacy Network, or PAN, and they advocate for people with Parkinson's, primarily in Washington, D.C., both with legislation and with the Centers for Medicare and Medicaid Services. So the most important thing that I want you to take home from today is taking control of your own life with Parkinson's so that you're improving your own health and your own experience of Parkinson's. But if you're someone who really wants to take control, not just for yourself but for others, research, support, and advocacy are other ways that you can do that. And if you're so inclined, you could get connected with all of those things at places like the World Parkinson Congress that Dr. Fong mentioned. Though having recently been to Vancouver, I can tell you that is a really, really long flight from here. It took me a day to get to Vancouver through Seattle, so it's a long haul from here in Gainesville. All right, so those were my slides, and I don't